Thanks for joining me. I'm Rasheeda Kabba, and this is Amplified. In this space, we amplify stories that make the fabric of our communities. Today, we're talking about the Black maternal mortality rate. Take a look at these statistics. In 2021, for every 100,000 live births, Black women made up nearly 70 deaths. This makes Black women 3 times more likely to die during childbirth than white women. All of this according to the CDC. Now, these statistics alone have made some women consider a practice that's been done since the beginning of time. We're talking about home births. For those not completely sold on giving birth from home, but they don't want to go to the hospital, there is a middle ground, and that's birthing centers. And birthing centers have garnered up a lot of popularity lately. These centers are typically led by midwives, which are trained experts in caring for women throughout pregnancy, birth, and the postpartum period, and other health and prenatal services. Now, some midwives are connected to hospitals and birthing centers, while others are certified but work independently. One woman who's made it her life's work to ensure equity within the Black birthing arena is Dr. Fatu Forna. She created the Mama Peking nonprofit organization that exists to provide mothers in Sierra Leone, West Africa, with resources and a safe birthing environment during childbirth. Now, Dr. Forna has worked with the World Health Organization and the CDC, and through the Mama Peking organization, she's focused on teaching and graduating classes of OBGYNs in order to drastically reduce the staggering mortality of Black mothers overseas. And joining me now to dive deeper into this topic is Dr. Fatu Forna, a leading OBGYN, epidemiologist, and author of Fight to Survive, A Black Woman's Guide to Pregnancy. Thanks so much for joining me, Dr. Forna. I know when we talked, you told me a little bit about how you've worked with the World Health Organization and led talks about it in Sierra Leone, formatting programs on maternal mortality, even graduating a class of OBGYNs. And you told me that you were supportive of birthing centers, but you also talked about your concern for women to hire midwives, Black women specifically, with that staggering statistic, when they hire midwives, to make sure that their midwives are not only accredited, but they're also tied to hospitals. Why is that something that is concerning for you when people do home births without a midwife that's tied to a hospital?
Thank you so much, for having this important discussion, Rasheeda. I think, what's important here is that we center mothers and babies. What we want to do is that we improve their health and make sure they have the best possible outcomes. What we do know is that, midwifery care is a very important part of the care that's provided around the world, as is care by obstetrician gynecologists. And some of the challenges that we're having in the U.S. is, we don't have enough obstetric care providers taking care of patients. We don't have enough OBGYNs. We don't have enough midwives. And I think that combined care is necessary to make sure we have the best outcomes for mothers and babies. And I think the challenges that we have with home births, there's a lot of interest now in home births, is that in the U.S., home births are not well integrated into our obstetric care system. The transportation is a challenge. The midwives, some of them are lay midwives that deliver at home, are not well regulated, and they are not well connected to the hospitals in case there was an emergency. We need to make sure those birth centers are close to hospitals and linked and integrated to hospitals so that, yes, most of the deliveries can happen in a place that we know there'll be good outcomes and moms are happy with, but they are backed up by an obstetrician gynecologist and an anesthesiologist and that emergency care in a hospital where if there's a problem with a mom and there is a problem with a baby, we can bring in those mothers and babies quickly.
Talk a little bit about how that can be dangerous. If somebody doesn't have proper access and then they decide to do a home birth, talk about the risks that poses, as well as how racism plays into some of the things happening in the hospital.
Yes, so I think structural racism and discrimination has really set up a system where here in the U.S., Black women are more likely to be uninsured, are more likely because of the stress of something called weathering, and chronic stress. They are more likely to have what we call high-risk conditions Some of those solutions include taking a look at what's happening in the hospitals that are keeping our mothers away. How do we increase our quality of care? How do we make sure we're providing culturally sensitive care? How do we train and integrate more midwives into our care? And how do we bring in birth centers?
Thank you so much, Dr. Fatu Forna, epidemiologist, OBGYN, and author. We thank you so much for your advice and your insight here on Local News Live.
Thank you so much.
And you're watching Amplified. I'm Rasheeda Kabba.